Hello, good afternoon, everyone, and welcome to the YouTube channel of MaxNyan Advisory. On the occasion of National Sports Day, today we are going to speak on the role of physiotherapy in sports rehabilitation. And I'm glad that along with me today, the show is going to be co-hosted by Advocate Rupali Thakur, who is
Good
the
afternoon.
founder and director of MaxNyan Advisory Private Limited. So, before going ahead, let me give you a brief idea about the MaxNyan mission and vision.
Today's generation from physical playgrounds and getting trapped in the world of virtual screens. The childhood of our kids is now locked inside keyboards, cartoons, and mobile frames. 47% of kids fall sick at least 5 times in a year, and 44 hours per week is spent in front of the digital screens. Parents are busy and children are left alone mentally and physically. This is not just a problem, this is a situation that has crossed the line of concern. However hard the situation is, but there is always a ray of hope, and that is MaxNyan Advisory Private Limited. With 35 years of practical experience in sports and education and a clear mantra, champions are made when no one is watching. This institution stands strong on the shoulders of two inspiring women. Vaishali Bhide Barve, ex-national cricketer, former captain of Mumbai women's cricket team, Guinness World Record prime singer, and 19 years of extensive experience in multinational companies. And Advocate Rupali Thakur, a hardcore sportsperson, an ex-national cricketer, international cricket scorer, 15 years of successful law practitioner, and a relationship counselor. MaxNyan's mission is to develop sportsmanship mindset amongst kids, to instill the spirit of will to win, and the vision is to become the sports mentor for the Indian Olympic cricket team, and to bring sports career awareness and clarity amongst 1 million families by the year 2030. The different verticals under MaxNyan is the need of the hour for every parent and their child from the age group 3 to 30 years. Sports nursery and power parenting for ages 3 to 14. Comprehensive scientific assessment for 8th grade to graduation. Overseas sports education for 12th grade onwards. What makes MaxNyan unique from others is the focus on bringing children back to the playground from a digitally addicted world, identifying each child's core competency and guiding them on the right path of sports or academics. Focus on complete mental health and holistic growth, creating an alternate income generation roadmap for youth. The physical activities conducted at MaxNyan Sports Nursery helps to develop motor skills, which improves balance and agility. Introduction and guidance on traditional and elite sports, muscle and bone strengthening, hand-eye coordination trainings, and most importantly, help to build a sustainable income generating pathway converting from passion to profession. A step-by-step process in MaxNyan includes smart parenting counseling, one-to-one interaction with kids, on-the-field training, continuous hand-holding and mentorship, and a clear future roadmap. All these ultimately results into the development of team spirit, social bonding, less screen, more real play, stronger immunity, discipline and confidence, cultural connection, and a happy childhood. MaxNyan conducts diploma program in academic competitive excellence and sports in collaboration with International Neuro Sports Association. Additionally, the Super 6 model, the Brain Book of World Records, and other programs for students from 5th grade to 12th grade are all developed for academic excellence amongst children and are accredited by the International Association for Sports and ICT. Sports is not just the playground, it is an ocean of opportunities. Various careers are available in the field of sports today. sports science, physical education, NDA, NCC, sports journalism, sports manufacturing, medicine, robotics, as well. In arts, commerce, science, and engineering field, there is a high demand for various sports professionals. MaxNyan is not just about training. It's about giving your child a bright start to their future. MaxNyan Advisory Private Limited. Think beyond the horizon. Do remember to visit our website www.maxnyan.com and please do subscribe to our YouTube channel MaxNyan Advisory. Thank you.
So, guys, on the occasion of National Sports Day, we have been conducting various sports activities for years together. And one of the flagship event of MaxNyan has been the Kids Sports Carnival, where more than 900 plus parents and students have participated from various schools. Similarly, this year we conducted Youth Athletics Championship for the age group of 12 years to 19 years. The Thane and the Navi Mumbai districts, where more than 50 plus schools participated and 500 athletes were a part of this youth festival competition. So let us have a look and a glimpse of this. MaxNyan always thinks beyond the horizon. So any need with regards to sports requirements, sports trainings, sports mentorship, sports guidance, or careers in the field of sports, do reach out to us. Thank you. So good afternoon, everyone, and welcome to MaxNyan Advisory Private Limited. And on the occasion of National Sports Day, we welcome you all. And today we have very renowned sports physiotherapist doctors who are amongst us. So I would like to introduce Dr. Sneha Joshi, who is the founder uh, of Positive Physiotherapy, wellness experience of about 15 plus years. She has a clinic at Thane West and does online consultation too. She is a certified McKenzie therapist, uh, podiatry practitioner, and believes in holistic approach. Specialist in treating spine and joint pains, and she leads a team of 4 physiotherapists who are all masters in orthopedics and sports. respectively. So, Dr. Sneha, we welcome you. Welcome on board.
Thank you. Thank you so much for inviting
Dr.
us.
Sneha, thank you. Welcome.
And we have one more doctor who is masters in musculoskeletal system. She is a senior associate doctor at Positive Physio. Her specialization has given her opportunity to treat various patients with sports injuries, and that would be useful for us in our today's discussion. So gladly we welcome Dr. Samiksha Moharkar.
Hello.
Welcome, doctor. Welcome on board. So, on the occasion of this National Sports Day, we both of us are very glad that you guys have decided to, take this particular session on role of physiotherapy in the sports rehabilitation. So, thank you so much for that, and we are happy that you are on the MaxNyan Advisory YouTube channel.
So, welcome Dr. Sneha and Dr. Samiksha. So, trainers are very trained trainers. They are taking this trainings from for these 3 to 5 years students. But the parents are saying, ki, no, no, this is not like, ये तो बच्चा मेरा घर पे भी करता है. So that is the reason we would like to ask this question. Being an expert, definitely you have given this right answer. So I would like to ask some question to Dr. Samiksha also. What is आपकी राय क्या है इस बारे में कि कौन सी लेवल तक देखना चाहिए पेरेंट्स को क्या होना क्या उनकी क्या जिम्मेदारी है इसमें.
Definitely, having a sports culture is very important because then you are putting in certain habits in the kids, right? Like discipline, which is a major habit. So at home, they might be, letting the kid play, या वो करवाते रहेंगे घर पे कि ये गेम खेलना है या वो गेम खेलना है. But the discipline with which they do it when they are in a particular center or under a particular coach, they know what exactly to do, how to do it, and what is the correct way of doing it. And that would cause less of the injuries, as well as it would be very useful in developing the skills as compared to when they are doing it under their parent supervision, because sometimes their parents are not really an expert into the same category. But if they are getting trained under somebody, and even if it is in the younger age and they are not really sure what they are doing, but if they are asked to do the or asked to play the sports in a particular way, they would develop something called as muscle memory, and that would be useful in a longer run rather than right now. But definitely they should be joining the uh, training under a expert.
Okay. Yes.
So, Dr. Samiksha, you have done your master's in musculoskeletal system. So, when it comes to treating various patients with sports injuries, what exactly goes into it? What are, I mean, are there any now, see, physiotherapy or for that matter, sports medicine or medicine for that matter has, there's a lot of trained that has come up. There's a lot of technological advancements that have been happening. So, how does now sports injuries are taken, or what is the care that is now taken from the conventional pattern?
We can see, like it is very much visible in the TV as well. Because giving an example of IPL, if we see any player that is injured on field, depending on how severe the injury is, there is always a physiotherapist available. There is always a sports medicine doctor available right at the moment, which means this is being taken care of immediately when the player is injured. And that is what matters in the long run as well, because in the ground, if the player is injured and he's being taken care of depending on the severity, for example, he is not having much of an injury, so the therapist or the doctor decides if he can play further or not. If the decision is made in a correct way, and if the injury is severe, and if they tell the patient to stop or the player to stop right away, so that can prevent the injury from becoming more severe. If it is in a level 1 injury that can recover in 5 days, it would recover in 5 days if he listens to the advice of the doctor and stops playing immediately. But if he does not, and if he pushes himself to play further, the injury might go to level 3 or level 4. Apart from this on field, whenever there are players coming to a sports physiotherapist or even to a sports medicine doctor, they are being taken care of very professionally. As in, they know particularly what to do, what muscle is injured or what tissue is injured, and how to take care of them. And not even that, but they are like, what conventional medicine or what conventional physiotherapy is that it focuses on reducing patient's pain. But when it comes to sports physiotherapy, or when it comes to doctors with a degree of sports medicine, they know how to get the player back into the field and how to make him play again and make him functionally capable again.
Okay, great. So, Dr. Sneha, even the holistic approach when it comes to, rehabilitation of the individual or a sports person. So, what would you tell our audience today about the pre-injury precautions?
Yes. So, like before any participation in any sports, like, things to be considered is the posture, flexibility, balance, and joint stability, and strength, even because the strength of a glute muscle can cause a knee pain too. So, assessing which muscles are weak and accordingly strengthening is very, very important, I would say. Coming to warm up, dynamic warm up like mobility drills and exercises, dynamic stretches should be done like, like shoulder circles or knee to chest. Again, that would be depending on sport specific, which the person is playing. So the static stretches, we see, people are doing calf stretches, hamstring stretches, holding for 20-30 seconds, which is people's favorite. But they should avoid this just before the game. As you know, the static stretching, I would say, can be beneficial during the cool downs,
Hmm,
post the game. So
hmm,
before the games, muscle activation, especially your core muscles, is very, very important. And I've been practicing podiatry since many years now. So foot posture has immense role to play in injury prevention. Sometimes the flat feet or the high arches or overpronated feet leads to injuries in knee, hip, or back, or frequent ankle sprains which we see. So correct footwear, like if you're training on turf, track, or hard courts, the footwear will vary accordingly. So,
hmm.
and the safe return to playing guidelines, like after minor injuries, matter a lot, I would say. So, adequate rest days, good sleep, hydration, and nutrition play a very important thing.
Absolutely. Yeah.
So, Dr. Sneha, is depend upon.
Like to add something to the previous point, wherein a lot of people tend to ignore the importance of hydration.
Yes.
So,
Hmm,
not just water, but also salts. So, maintaining the electrolyte balance is very important because they sweat a lot when they are playing, and that leads to a lot of injuries that we see. So, getting hydrated before the play and keeping yourself hydrated during the play is equally important to avoid injury.
hmm, hmm.
It depend upon which game and what type of game he's playing, how aggressive he is, depend upon that. The injury also, the recovery part also. So, just a question to Dr. Sneha. Uh, we are talking about kids now. Then what about the masters? The players are playing after 40 or 40. Nowadays, many people are play. They started their career after 40 also. So, what is your advice to them? many cricketers, even, nowadays very different, the paddle playing, people
Yeah,
started
yeah.
playing after 40 or 35, 40. So what is your advice to them?
If the player is, any person is wanting to play a game after they are 35 or 40, there are just certain precautions that should be kept in mind. But that actually depends on if they have played any game earlier in their life, or if they are starting with a very new format, or they have never played and this is the first time they are doing it. So if they have had an experience in playing the particular sport and there was a big gap, then definitely they do need training. And post the training, they can go into a competitive sport. And that depends on their current status, physical status. And if we compare them with a person who is completely new into this category, I think they will need a lot of training as compared to the other person. So they need to go a lot of they need to undergo a lot of training. And if their coach thinks that they are fit enough to go into the sport, only then they should be allowed. Because if you're not trained earlier into your life, or
Hmm.
if this is or even if you're under trained at the moment, that those are the leading causes for getting yourself injured.
No.
And as we know, as we grow old, the tendency of our body or our brain to learn new things reduces naturally. So if you're starting new at a later stage, you might not catch up with other people. And during that time, you should be aware of what your body is telling you rather than pushing yourself in wrong places.
Hmm.
This is very important thing, because as a coach, I'm going to push you as a for better performance, but as an expert,
Hmm.
you in a very in a physical way, this is different advice for them. Okay.
Yes.
Hmm.
Yes, Dr. Sneha, you would like to say something about it?
Yes, absolutely. I agree to Dr. Samiksha. Definitely.
Okay. So, what stage do you feel that there are chances of recovery from a sports injury? So, at what stage the a person should sports person should come to you?
So see, anytime like the acute the injury, the fresh the injury, they should immediately seek healthcare professional or a physiotherapist, because chances are faster, and with fewer complications as they get injured, if they see a healthcare professional, the recovery is anytime faster than after many days and passed on. So many a times, after few days or, after you get injured, you don't Google and see your symptoms, what is happening, what should be done at home. This might complicate the case, because if there is internal trauma or something that needs to be at times scans, or any, the special investigation is needed. So the recent injury, the fresh injury, seek healthcare professional guidance immediately, I would say that.
Okay.
And the
All right.
chances are definitely good for the recovery. Many a times, 100% the recovery chances are there.
Okay. Great.
तो ये फीमेल और मेल में रिकवरी टाइम के लिए कुछ ज्यादा फर्क रहता है कि मेल्स टेक सम मोर टाइम और फीमेल टेक सम मोर टाइम फॉर रिकवरी?
Not really, actually, because there are a lot of studies that suggest that many times फर्क नहीं पड़ता है, even if it is a male or a female. नेचुरली हम ऐसे सोचते हैं कि फीमेल्स में हॉर्मोन्स अलग होते हैं एंड मेल्स में हॉर्मोन्स अलग होते हैं. बट वो तभी रोल प्ले करते हैं जब भी ट्रेनिंग का पार्ट आता है या स्ट्रेंथनिंग का पार्ट आता है. क्योंकि व्हाट फीमेल्स डू इज दे ट्रेन फास्टर, बट जो स्ट्रेंथ वो अचीव कर पाते हैं वो उतना नहीं हो पाता. बट वो दे आर क्विक इन लर्निंग. बट जब हम मेल्स की बात करते हैं, तो मेल्स जो है वो दे टेक अ लॉन्गर टाइम, बट उनका जो स्ट्रेंथ बिल्डिंग रहता है वो ज्यादा रहता है, ऑब्वियसली बिकॉज ऑफ टेस्टोस्टेरॉन. सो
Hmm.
दिस इज वेयर जब इंजुरी का बात आता है, तब फीमेल्स आर लेसर प्रोन टू इंजुरी समटाइम्स बिकॉज ऑफ हॉर्मोन सच एज ईस्ट्रोजन, which makes their muscles more flexible. So they tend to injure their muscles very less. But If you compare it to males, they lose or they injure their muscle quite often because of testosterone. So this is where the difference is. But when it comes to recovery, they almost take the same time to recover. So there are no studies yet done that show there is any major difference or anything between that.
Hmm. Okay. So now, as you know, that MaxNyan Advisory is also into guidance on careers in sports. So while we do the trainings for 3 to 10 years through our sports nursery, and kids at the age of course, you have already Rupali has already shared that 3 to 10 years of age group are there, but the mindset of the or rather the anxiety or the overwhelmed parents always feel that yes, their kids need to be faster enough to pick up those, grasp those things, and then deliver it as quick as possible. So, what would you advise on such cases? Of course, what has to be the competitive age for playing? What has to be the molding age, or rather, does the molding age really matter? All these things, if you can share, throw some light on it, it would be really great.
Yes. First of all, I think many a times it is, the parents' choice of sport, which is, उन पे ये किया जाता है. मैं हमेशा
Mhm.
सचिन बनना चाहता था, मुझे क्रिकेट बहुत पसंद है, मैं मेरे बेटे को क्रिकेटर ही बनाऊंगा. बट we are just not aware, physically, mentally, or what mindset your kid has. So basically, I think let the kid explore all the sports.
Yes,
जो हम 3 साल से बोल रहे हैं कि एंटर करना चाहिए. सो द एकेडमी शुड अलाउ द किड टू enjoy or get hands on to all the
exactly.
sports, and let
Absolutely.
the kid decide, or the mentor, he is the best judge. He gets, kid को किसमें रुचि ज्यादा है, or the thing which he would like, he will definitely excel in that respective sport, I think, irrespective of what coaching,
Yes,
he's getting. Of course, coaching matters, but what the kid is gifted with, I think that
yes,
is very important. And
Absolutely.
second is stress, the parental pressure. It's just not limited to the studies, I would say. वो sports में भी, और it's immense in this field. So I have few kids, who come for the rehab. So it's like I have a match tomorrow, but then I'm chill, but you say something to my dad or to my mom. So we come across such cases. Yes, definitely.
एग्जैक्टली वी आर डूइंग सेम थिंग कि सब गेम जो है उनका एक पहचान होनी चाहिए उसके बाद ही. बट वी आर लाइक सो मेनी पेरेंट्स आर सेइंग कि इसको
They have a very
फुटबॉल में
high
पूछिए.
expectation
हाँ,
from the kids,
फुटबॉल में
which I
रुचि
think,
है, क्रिकेट में
हाँ,
रुचि है, यहाँ ही डालना है, ऐसा ही करना है. द प्रेशर व्हाट एवर यू आर टेलिंग राइटली सेड. बहुत प्रेशर होता है पेरेंट्स के ऊपर ही कि कौन सा गेम, और हमारी जो अधेरी सपने हैं वो सब दे जस्ट वांट टू that is the
fulfill
reason
it
we
from the
full.
kids.
Yes. So yes,
Yeah.
Vaishali.
So, on the career in sports, both of you guys are into physiotherapy. So you did physiotherapy, and then you did your specializations into podiatry, and then sports also, sports orthopedics and sports masters. Dr. Samiksha is, and Sneha is also into that area as well. So, what would you guide the students who are into the field of medicine with regards to what is the future for the physiotherapy area, or what are the advancements in this area where they need to focus on or they need to look forward for now going forward?
The field of sports physiotherapy and sports medicine even is very upcoming. So looking a decade back, we could not see a lot of sports physios or sports medicine doctors. But right now, they are into focus or into picture. And I think that is very important because a particular specialization would help you more into understanding what the player actually needs and
Right.
will be helpful in fulfilling those requirements of a particular player. So there are a lot of advancements wherein it would help a particular player to get recovery faster and in a better way. So
Hmm.
as simple as I think there is one technology. Obviously, it is not very well developed in India because of the costing, maybe. But there are a lot of technologies where you can track the player's movement patterns, wherein there are particular markers on the joints, and then you ask the player to play or perform the movement that they are doing in the game. So
Hmm.
that helps the therapist track how they are doing biomechanically, which means is their joint moving in a correct way that it should be
Oh,
doing, or is there any fault in that pattern, so they can correct him accordingly, which would
oh,
help him
great.
enhance the performance as well as prevent any injury. So this is
Hmm.
how the advancement is going on. And I think in a few
Fantastic.
years it would definitely come in India. It might be there, but obviously it is not very
I
cost effective at the current times.
I think AI might also be of help here to a large extent.
I don't agree with this
No?
because I think what AI does is it is just sitting in a room and making you wonder what you can do and what you cannot. Whereas
Uh,
if you are on a field, you know what is going on, and
no,
sometimes
I'm saying from the detection perspective, AI might help to some extent.
on not really, because what you do is AI is a programmed thing. So rather than a AI tool, I think someone who is an expert and who is looking at the patient as or the player as a player itself and knowing their full history
Right.
uh, would make a difference.
Okay.
Like as I
Great.
would like to add, not solely dependent on AI or the technology, the clinical uh, expertise is always important. As
Absolutely.
a treating doctor knows the in and out history and assessing clinically, that really matters.
Absolutely. Absolutely. Great, fantastic. We have almost covered a lot of aspects here today, and we'll continue with this series on physiotherapy, the role of physiotherapy in sports rehab, and we'll soon come up with another session also on these kind of sessions, definitely, where we'll get into the details of further assessing. There are a lot of aspects of assessing the muscular strengths, the bone strength of the individuals, which might be of interest to parents who would be watching this video. So, in our next session, we'll definitely come up with these aspects where experts like you would uh, give us a detail or a deep insight about this subject. So, we, on behalf of MaxNyan Advisory, really thank you both the doctors, Dr. Sneha Joshi and Dr. Samiksha Moharkar, for being here on this platform. And we'll definitely be in touch. And once again, for the audiences who are watching this, you can contact us, you can comment in the comment box, and do subscribe to our channel and share this video to maximum people as possible, because sports physio therapy or the rehabilitation of a sports person is extremely critical and important. So the more it spreads, the more the better for our sports persons. So thank you very much. Uh,
Thank you. Thank you so much. It was our privilege.
Thank you.
Thank
Thank
you,
you,
Dr.
Rupali, for
Thank
Sneha,
being the
Dr.
co-host.
Samiksha. Thank you, Vaishali, for conducting this. Thank you so much.
Thank you.